First of all, welcome to everyone. I'm Bob Benson. I'm the chair of Dundee IJB. This is my first meeting with you, and I'm looking forward to the quite enormous agenda you have in front of you here today. And I'm looking forward to working with my vice chair, Ken Lynn, as well. And I'm working with Dave, of course. So very much welcome to you all. And Arlene, before I move on to your information, could you tell me, are there any special welcomes today? I believe that we've got a representative from Fres. Is that correct?
Yes, that's correct. There's a rep from DC Thompson's.
Thank you very much. Can you take us through the apologies?
Yep. Chair, usually what I do is just remind everybody that the meeting's being recorded and will be placed on the websites of Dundee City Council and the Health and Social Care Partnership for public viewing. And then I would go through a roll call for the minute. Is that okay?
Yes, that's fine.
Okay, so if people could just say they're present. Bob Benson.
Present.
Councillor Lynn.
Present.
Councillor Toland.
Yeah, present, aye.
Councillor McHugh.
Present.
David Cheap.
Present.
Beth Hamilton.
Present.
Glenn Lloyd.
Present.
I've had apologies from Vicky Irons, Dave Berry.
Present, Arlene.
Christine Jones.
Present.
David Wilson.
Present.
Susie Flower.
Present.
Sanjay Pillai.
Present.
Raymond Marshall. No. I've had apologies from Jim McFarlane. Christina Cooper's going to join the meeting later. Liz Goss.
Present.
Martin Sloan.
Present.
I've had apologies from Emma Fletcher. David Shaw. And that concludes the roll call, Chair. Thanks.
Thank you very much indeed, Arlene. Right, section 2, any declarations of interest? Thank you. That takes on to item 3, the minute of the previous meeting, and that was held on the 17th of April and is attached for approval under 3A. Can we have any comments re the accuracy of the minute, please? Yeah, Dorothy, did I see your hand up there?
Yes, page 2 of the minute, under item, well, the bit about the action tracker, the second bullet point in relation to older people and carers and having them involved in the Falls group. Matthew Kendall was following up on identifying reps. Should that be on the action tracker? I don't see it on the action tracker.
Dave, do you want to pick that question up?
Yeah, we'll add on. Unfortunately, Matthew's not here today, so I can't give a kind of a response unless any other colleagues kind of know of if that's actually been taken up. But we'll certainly kind of make sure it's on the action tracker and picked up for next time round. So
that's fine, Dave. I'm not looking for an update. I just would like it noted. Thank you.
No, that's fine. Thank you so much. Any other questions about the accuracy? No, I don't see any. Can I now move to a proposer and a seconder for this minute, please? And thank you, Dorothy. Thank you, David. Okay, the minute is now approved. That takes us on to action 3B, the action tracker. Do we just want to go through these in order? And I believe, are we asking for the responsible person for each action to speak to this, Dave?
So normally what we do is really just kind of open up for any questions on any particular concerns on the action tracker, and any kind of the lead officers would kind of respond. So so I don't know if you want to kind of open that up, Bob.
I'm happy to take that course of action. Some are fairly straightforward. I think there was one, mental health and learning disability improvement plan. That was number 2. Its original timeframe was June 2024. I believe that has now shifted. Do you want to just do a bit of explanation around that one?
Yeah, so there is a kind of draft report that, in terms of an update on the mental health kind of change programme, and we're now planning on taking that one to August. The kind of pre-election kind of period was one we considered when taking that that kind of decision to defer it. So I think there'll be a report that will be going to both Angus and Dundee and NHS Tayside Board in August around the programme update.
Can I ask a further question related to this before I bring in Dorothy? There was discussion around a particular development session on this work. Can you add anything more to that?
Yeah, so that was one that was being considered as a kind of Tayside approach. I think there's plans for an NHS board development session to be held in July, but there was acknowledgement that that's for particular kind of councillors, that's kind of council recess as well. So myself and Jackie Pepper from Perth and Jill Galloway will be kind of looking to see what we can do for IJB members on that topic.
So what we're saying is that this development session may not happen before the August paper. Is that correct?
Potentially, given the sort of the timescales with the annual leave, the kind of leave period coming up, Bob. So.
Right. Okay. But it's clear that we need to have considerable session on this particular area of work. So that has quite a high priority in terms of our development sessions as planned. Thank you very much. Are there any other parts of the action tracker that board members wish to comment on?
Dorothy's got her hand up, Chair.
Sorry, Dorothy, I missed you. Dorothy, please.
That's okay. I have one specific point and a general point. I'm a wee bit confused because on the agenda note number 6, we have Learning Disabilities and Autism Strategic Plan 22 to 27. And then it talks about an operational plan. And on the action tracker, we have Learning Disabilities Strategic Plan. It talks about a commissioning plan. And number 2 on the action tracker, Mental Health and Learning Disability Improvement Plan. There's just so many different variations. We have, what do we have? If somebody could explain that to me, please, so that I can get my head around it. We have commissioning plans, we have mental health and learning disability, we have learning disability and autism. There's just a whole variety of different headings there that they probably mean the same thing, but it's very confusing to me. So that's my specific point.
Well, shall we move? We'll deal with that one. Yeah, I can understand that exactly, and Dorothy, although I appreciate that agenda item 6 is an update, but Dave, can we kind of sort out some of the potential confusion around this?
Yeah, so Jenny will come in on that. Thank you.
Yeah, I think what we've got locally is the Learning Disability and Autism strategy, and then there's a one-page kind of easy read strategy. What we have in the background of that is quite a detailed operational plan that we're working to in order to implement that. And I think where it gets confusing is that's then feeding into a Tayside-wide whole system approach where there are commissioning plans associated with that.
That's fine, Jenny. Could you perhaps email me that so that I can, I have it written down and I know what plan's what plan and what strategy is what strategy.
Yeah, of course.
Thank you. And my general point is, it concerns me that the action on the action tracker, actions are delayed, put back, delayed, put back. You know, most of them on the action tracker are delayed actions, and some of them are delayed more than once. Now are we being over optimistic in our judgment of timescales, or is there a deeper issue here? You know, we're just not, the actions are not being completed, and they're just put off and put off and put off. And in some instances, the status says complete when it is clear, like for item number 1 on the action tracker, it says complete, but it clearly not complete, because we're still waiting for an update in August 2024. So it concerns me that we're just putting off and putting off and putting off. And I see this as a risk to the work of the board. And I wondered if we should identify this as a risk. Dave, you'll be able to tell me if there's anything about this on the risk register.
Before I bring in Dave, and Dorothy, I completely concur with everything you've just said about these delays to key areas of work, and whether it's being over optimistic or even achievable, actually, in some cases. So I have a concern about that as well, and that's certainly something I, as chair, will take away with the vice chair and look at this action tracker in more detail. So I take your point well. Dave, do you want to answer the specifics?
Yes, no, thanks for that. And there's probably kind of a number of different reasons why things have kind of slipped. So some of them actually things will have slipped, whether it's around resourcing, whether it's around kind of people not being available to kind of complete the pieces of work that were originally planned. Some of them have actually, so there's a number of them on the list which over the next kind of couple of kind of months should disappear because they're linked with specific development sessions that the IJB has asked for. So we'll kind of be able to kind of cover those off within those. And there are other things that are actually, you know, because of the nature of them, would naturally be a longer timescale for a completion. So it might be, you know, the IJB's asked for something, but the natural kind of cycle of things is that's another 6 months before that would be kind of dealt with. So there is a combination of that, but absolutely kind of conscious of the fact that between both the IJB and the performance and audit committees, and a number of actions are put on that are not kind of cleared off as quickly as we would. I think there is something for us as well around being kind of too eager to kind of please in that regard and try and kind of get things, you know, maybe ask for one meeting and say we'll have it sorted for the next, because actually the actual timescales between the meeting finishing and us writing the next set of reports is actually pretty minimal. So I think we need to kind of reflect that ourselves in terms of being kind of less ambitious around what we can deliver within that. But I see Jenny's got her hand up, maybe about one or two
It's probably
specific points.
just to add into that, a lot of the actions were around development sessions, and I think there were particular delays around that, but hopefully we've now got those planned in, so that'll move quite a few of those forward. I think the other thing was just to clear up the again, it relates to this confusion between the Tayside-wide bit and the local bit. So the bit that's completed on the action plan refers to the update about the local work. The report that we have, and we actually have a draft report for the mental health learning disability whole system Tayside-wide, but I think for the reasons Dave said, that's been deferred to the next meeting. But that's the one that's outstanding to bring back.
So just taking some of the information out of and just reflecting on what's been said, I think we need to take this action tracker and have a good look at it, in fact, in terms of the realism of the timescales for a start. That's one obvious comment. I think that the second one is, for me, is this issue about around development sessions. Now, I'm familiar with having a set dates for development sessions. Now, I realise that that's more difficult with pan-Tayside development sessions, but I do think we should at least know what Dundee IJV's development sessions are so that people can plan accordingly, as we do with the IJV meetings. So I would quite like to see the development sessions exclusively for the Dundee IJV set out looking ahead. And even if we've got a date there, we appreciate that things can change and they can change. But I do think it's important that board members know in advance what they're going to be looking at, even if we're not quite sure what the agenda will be for each development session. I do appreciate that, but it would be really helpful if we actually had some dates in the diary that we can start to plan ahead so we know that something's going to happen that day. So that would be my reflection on this, and I'll take it up with Dave post this meeting. Is there anything, Ken, you want, and Dave, you want to come in, and then I'll bring Ken in, and then I've still got Jenny on.
Yeah, no, thanks for that, Bob. So, yeah, we do have dates kind of set out, and I'm just check with Arlene to see whether have they been set out for all members, or have they just been held in officers' diaries just now? Can you remember how that's going out?
I think they're in everyone's diary, but as we know, there was a problem with the distribution list with Bob, so maybe that's why Bob's not got a note of them. But we do have the dates are actually out in the diaries, but it doesn't say what the topic is. So the dates are held.
Yeah. Can I suggest then that on the agenda, as a matter of course, that we put down the development session dates as well on future agendas, because they may change in the interim, but it would be really helpful to have it for the board members as opposed to for officers and exclusively for me and Ken. So thank you for that. Ken, do you want to come in now?
Yeah, just to echo with that, I suppose I think it would be a good idea to identify dates well in advance and just stick to them and slot in whatever the topic is nearer the time. Regarding the action tracker in its totality, it's a shadow of its former self, I have to say. It used to be much longer than this. And I don't know that the operation of the IJB is necessarily affected very much by the items that are in amber, although I appreciate the necessity in getting them to green. But I think we also need to remember the fact that in terms of the senior staff, you know, we have capacity issues at the moment, and I think we should take that into account. Thanks.
Thanks, Ken. I'm very mindful about that last point. Dave, do you want to come in finally before I move on?
Yeah, sorry, just one last kind of comment on the development session side. So, yeah, so tomorrow's session will be on governance. What we've got in terms of a plan around kind of future ones is to actually ask the IJB what particular issues you would like to see. Now, we have got some others again picked up from the action tracker. We've got some risk. We need another development session on risk appetite. We also need a session on kind of performance management, data, etc. Again, based on issues that have arisen through previous IJB meetings. So, we've got maybe 2 or 3 of the next sessions that we've got kind of topics for. But after that, it'll be a case of asking yourselves as members as to what items you want to kind of see in terms of development. So, but the plan tomorrow was to kind of have a quick discussion about that at the end of the session.
Right, we'll have that at the end of this meeting. Then you can have a quick conversation with me about that, if I may.
I'm suggesting that tomorrow's development session.
I don't have it in my diary.
Right. Okay.
So. Yeah, well, I'm just making the point is that if I'm getting confused with it, then others need clarity on it. That's all I'm saying. And I appreciate again the pressures on your particular situation, Dave, and others who are all acting up in many different ways. So I do appreciate that. Thank you. I now want to move on to item 4, Performance and Audit Committee NHS membership appointment. And within the agenda, it's been set out that there I won't read it out because it's longer than it needs to be. Due to James Cotton's resignation, the board's instruction request with regard to the appointment of Sanjay Pillai to fill the vacancy from the 19th of June. Welcome, Sanjay.
Thank you.
Thanks very much indeed. I knew there was someone I needed to say welcome to, and I'm glad I was able to do it just now. Thank you so much. So, thank you. That takes us on to item 5, Performance and Audit Committee, the draft minute of previous meeting of the 22nd of May, and a copy is attached. Are there any questions about the accuracy of the minute? And presumably we need to propose and second for this one. Do we normally conventionally, or do we just acknowledge it?
I think it's only the Performance and Audit Committee, Bob, that can approve it.
That's fine.
Yeah.
And so you chair that one, Ken. And if that's the case, then this is still a draft minute, so it's still to be approved by PAC. Is that correct?
Yes.
Right. Okay.
I think we had a discussion about this, and I asked the question: is it right that we bring a draft minute to the to the IJB before it's actually been approved? But Dave felt, and I agreed with him after listening to what he had to say, that it was probably a good idea, given that there's 3 months between PAC meetings, just to bring the draft agenda along and hope for the best, really, that there was nothing on it that was dreadfully inaccurate, but it's there for information purposes in the interim before we actually approve it in May, June, probably September.
That feels like a long time. What I conventionally do, Ken, is that because it's been unapproved, I usually ask the chair to do a verbal update on the meeting as opposed to presenting a minute, and you could use the draft minute as your reference points, but I usually ask for a verbal. And if we should meet this situation again, I'm more than happy for you as chair to do a verbal update on the minute and pick out the key salient points from the meeting.
Well,
that would certainly cover it for this
item. That's kind of covered by item 5B.
Yeah, exactly. Yeah. So it's like, well, what I'm saying is it's not an approved minute, so the chair's assurance report should really follow the approved minute, I would have thought. But
sorry, I'm not with you.
Well,
the chair's assurance report is item 5B.
Yeah, no, I've got that here. So you're saying this is your record of the meeting?
Yes.
Yeah.
But item 5B.
Yeah.
Yes.
But if that's the case, that's fine, if that's what you're presenting. But I'm trying to get back to your previous kid. If there was no assurance report, we would still need to have some kind of update from the meeting. Yeah. But I won't labour this point any further.
No, it's a bit of a technical point, isn't it? Yeah.
Yeah. Okay. So that's for noting, and 5B, chair's assurance reports for noting as well.
Yes.
Okay.
It's quite fairly concise. It's a fairly concise report.
Yeah.
I don't know if there's any questions on that.
Okay, David, you want to come in?
Yeah, thanks very much, Bob. I just go back and query this. I think, as Ken's just said, it's fine for the chair's assurance report, I think, to be given to this committee in advance. I don't honestly really understand, again, why we're putting a draft minute into this committee's papers, because probably when the actual formal minute is agreed, it'll come back again and saying it's an agreed minute. I don't think we do it in any other place I can think of to put a draft minute into paper. So I would suggest, I know it's a long time between meetings, but really, what use is it really? I don't think we should keep to a system and only publish these things when they're approved and submitted at that time.
Yeah.
It's just, and I can understand for information purposes in some respect, but it kind of goes against the basis we normally do with all committees, I think.
Yeah, I take that point, and I think Ken's made a similar point as well. Dave, can we just respond to that? I'll bring Ken again, then I'll move on. Thank you.
Yeah, I mean, I'm kind of happy to take that one away and discuss with Jocelyn in terms of internal audit or external audit partners as well, in terms of that that kind of process, because we just don't want to kind of make sure by doing that we can undermine any of our sort of governance processes. But happy to do that and take that away and come back with a recommendation on that one.
Okay.
Ken, final word.
Yeah, that's pretty much what I was going to say, Dave, because having said what I said, that Dave convinced me that it was a good idea. Having listened to what David said, I'm not so sure anymore. And I take his point about that doesn't happen anywhere else, because it doesn't in my lengthy experience in local government to have an unapproved minute. So yeah, let's speak to audit and get this sorted out once and for all.
Well, thank you for that. I think we will take that away and we'll sort this out. But we're not, in my view, we should not bring an unapproved minute to this agenda, frankly. Thank you very much indeed. That now takes us on to item 6, Learning Disabilities and Autism Strategic Plan Update. And I believe that's Jenny Hill, is that correct?
Thank you very much. Yep. It's just a quick update note in relation to the local work that's been undertaken around the implementation of the Learning Disability and Autism Strategy. So I won't kind of go over what's in the agenda note, but just to draw people's attention, because I know that people have a particular interest to some of the co-productive work that's involved in this and the events that are happening in local areas on a timescale and the recent event for carers. At a high level, the work continues to develop community models of care, prevent admission to hospital, and generally moving away from institutional models of care, implementing the Coming Home report, and happy to take any particular questions in relation to that work.
Just a point really for me as chair. Normally, I wouldn't expect to see the update on the agenda itself. Is that convention here? On the agenda, I actually have the update, which is unusual. And I let it go because it was already there. But it's unusual to see this on an agenda. It's usually a separate paper or a verbal update. So I'm just curious as to why it's actually on the agenda, the update itself. And before we move on to content, Jenny, which is really interesting. Thank you, Dave.
Yeah, sorry, just in relation to that, we do have a kind of process where we can, if we're doing updates, we can do an agenda item. Sorry, a kind of short agenda note, as we describe it, rather than the full report. Rather than having the full kind of formatted kind of report for something like that. There's not an awful lot in it, if you see. So we take that opportunity, as we do have within Dundee City Council, to kind of put in agenda notes into the system.
I think though the question was in relation to it actually being included on the agenda rather than a separate agenda note paper. Yeah, my experience is that has been a local convention.
That's what that was my question really. Well, I think I'll look into that. But anyway, do you want to any questions on the update itself from people? Ken.
Yeah, thanks, Bob. My question really, something that concerns me about in item 6 is the mention of the remobilisation on a face-to-face basis. Is this a recent remobilisation? Because the pandemic is etched in all our memories, and that was some years ago. And it's really sad in a way to see, I was going to say disappointing, but it's quite sad to see that work is having to be underway to build up the wider membership again. Because clearly the input is crucial. So, yeah. A, why did it take so long? And B, how quickly do we hope to build up that wider membership again?
Yeah, Jenny. I can't, that's not one that I could answer to the detail of, Ken, so I'd need to go back with that. But I think so many people have moved on post-pandemic, but I wouldn't think that's a long kind of timescale to get that back up and running.
Yeah, but post-pandemic was years ago, though. That was my point. Yeah, this is 2024. The pandemic was it 2020? Yeah, so to 2021, and it's 3 years later we're just getting around to face when that's proved to be so important for this particular group.
I'll take that one and give you an update as to the timescales around that, Ken.
Thank you.
And the kind of current state of play.
Okay, and are there any further questions on this update? I was really interested, just as a reflection on looking at the previous minute, around the work that's been done around the learning disability and autism and neurodivergency bill consultation. And I was really interested to see how that work and the group of people who are really involved in that would be heavily involved in kind of the work that's being done. So I'm quite pleased to see the well-establishment of co-production in that area. And maybe this is something I'll come back to, something I said before the meeting about that engagement with carers and users of services, I think is really quite critical. And so thank you. I just commend that work, really, that folk have been involved, and thank you.
Thank you. I'll pass that back.
Thank you. That now takes us on to item 7, Annual Internal Audit Report.
Hi, Bob. I'll introduce.
That's Christine Jones. Thank you,
Yeah.
Christine.
I'll introduce this one and then invite Jocelyn Lyle to come in and pick up any other follow-up or key points from the report. So this is our annual internal audit report. It also this time incorporates the annual control evaluation, which is part of the internal audit plan. So it is a fairly lengthy report, and it has been sent out as a supplementary part of the supplementary agenda. So apologies for getting that out late, but hopefully that's still allowed members enough time to have a look at it. And we can pick up any questions or any feedback after Jocelyn's spoken as well. The report does have a number of recommendations, but also pointing out a number of our good practice that's been identified through it. Looking at the overall governance system that we've got in place, and as a management team, we have looked at these recommendations and noted our response, and we'll obviously build in the actions during the coming coming year to progress these ones as well. But I'll let Jocelyn pick up the sort of key points of the report as well. Thank you.
Thank you, Christine. So as Christine said, that this annual report really provides a holistic overview of governance within the IJB. So we cover corporate, clinical, staff, financial and information governance, and it's providing you with overall assurance on the IJB's arrangements for risk management, governance and control. Just some of the points I wanted to highlight. We've talked about our 22-23 annual report, which made 3 recommendations that are still in progress. So the first of those was on sustainability, and specifically development and implementation of the annual delivery plan, the resource framework and the performance framework to support the implementation of the strategic commissioning framework. And as I say, we've made a point that that's still in progress and is a very important issue to be taken forward. The second recommendation was on ensuring members are involved in development and agreement of the organisation's risk profile, and making sure that risk appetite features in decision making. And as we've talked about already, we're aware there will be a development session on that. Thirdly, and probably our key recommendation from last year's report, this one was about streamlining and prioritising action to address our previous recommendations. So members of the Performance and Audit Committee will be well cited in this. There are updates on the governance action plan to each meeting, and the mapping work to develop reporting of those governance actions is now complete, but there is still work to be carried out on linking the required action, be it from an internal or an external review or internal or audit report or an annual governance statement action. So linking that to the progress made and the action actually being taken. Now that has been a bit delayed because of resources being diverted in preparation for the changes in the IT structure. And a further update will come to the pack in September. So building on that previous recommendation, in this report we've suggested that it's action point 1, there should be a clear escalation to the IJB of any outstanding issues that may impact on good governance, and that consideration should be given to developing an accompanying risk. It just made me thoughtful during the conversation earlier about the action tracker, that this is something you may want to pay a bit of attention to in terms of actually, you know, making sure that these actions are prioritised and there's a systematic process in place to make sure things are done. And just to say, I would completely agree with the commentary on being realistic about deadlines and what's achievable within the, you know, with what's available resource-wise. So probably on a very similar point, as auditors, we're always looking to confirm that effective action has been taken to resolve issues. So in this report, in section 2, we've summarised all the outstanding internal audit recommendations, and that starts on page 45 of your papers. As I say, there are still several outstanding actions, but we do acknowledge the pressures that have impacted on moving along this improvement and governance activity. So just in terms of the key themes, many of the themes and findings in this report will be familiar to you. We've reported these before, particularly issues in relation to delivery of strategy and transformation and the flow of assurance over risks. So that ongoing work in the governance action plan will help ensure that prioritisation and systematic addressing of these. As we have done in all our client annual reports, we've reported the well-known difficulties in the external environment, including increased demand, an ageing population, the widening health inequalities, and of course significant and unprecedented financial challenge and the workforce pressures in the face of that growing demand. And these are common to all public sector organisations. And you know, we acknowledge that difficult decisions and prioritisations lie ahead. We've been very clear in this report that financial considerations need to be at the heart of everything, and that focus on transformation needs to be maintained, and really looking to do things differently. So in summary, this report is saying that we need concerted, prioritised, and I keep using the word prioritised, but action to ensure coherence between governance structures, performance management, risk management and assurance, and really just to improve the IJB's ability to monitor the achievement of objectives. So in terms of my formal opinion, I have concluded that reliance can be placed on the IJB's governance arrangements and systems of internal controls for 23-24. I have not advised management on any concerns on consistency of the governance statement with information that we're aware of from our work. I haven't advised of any concerns on the format and content of the governance statement in relation to relevant guidance, and I haven't advised of any concerns on disclosure of relevant issues. That's all I wanted to point out and to highlight, but I'm more than happy to take any questions. Thank you.
Thank you very much indeed. Actually, Jocelyn, I really enjoyed reading this report. I thought there was a lot of good stuff in it that we need to focus on, as well as the assurances that you provided as well. Then I'm going to open up to questions now. Thank you. I think you seem to have knocked them dead, actually. I think they're stunned silence. Quite a lot of work for Pat here, Ken.
Yes, indeed.
Yeah. Okay. Well, I think that's, I didn't expect to get through this one so quickly. So, Jocelyn, thank you so much indeed. And I think there's a lot of food for thought in what you've said here that we need to look at, particularly some of the things around about delivery plans, etc. And I'm quite looking forward to progressing some of these. Thank you. Jocelyn, do you want to come in finally?
Yeah, it was just to say, Chair, if I could just take the opportunity to thank Dave and Christine and all the people who helped with the, you know, clearing the report, and to the internal audit team, because as you say, it's quite a lot of work. We're really content with the management responses that we've been provided with and the speed of turning around the report. So I think we have a way forward, and we'll look forward to keeping an eye on these things through the next year and seeing all these improvements coming through. Thank you.
And thanks very much indeed. Thank you so much. And so we will now move on to item 8, unaudited annual accounts.
Thanks, Bob. Yeah, I'll pick this one up as well. So IJB is required, obviously, to present and prepare annual audit accounts under the auditing standards. So these are our financial statements and unaudited accounts for the financial year 23-24, along with our corporate governance statement. These are presented for approval from the IJB, and then we will pass on to Audit Scotland to progress the audit work, which we should then bring us back to presenting the audited accounts in November, I think it's currently scheduled for. The audited accounts document is obviously attached in Appendix 3, containing all our statutory details and financial information, along with a lot of strategic information that the IJB and the Health and Social Care Partnership have developed and progressed during the last financial year, including information on population demographics, with the people in the city, and through the management commentary, we've also detailed a lot of our information about our strategic framework priorities, our key achievements during the year, and ongoing developments to support the people of Dundee. In terms of the financial performance, the total resources for 23-24 are just over £336.8 million, so a substantial amount of resources across the city. And we have reported a deficit in the annual accounts of 6.155 million during the year, which is in line with really with expectations. So the part of that using is under the statutory accounting treatment that we need to note, part of that using our planned reserves, and part of that is actually other reserves adjustments on committed reserves as well. At the end of the financial year, the IJB continues to hold reserves totalling £17.8 million. 11 million of this is held as committed for specific purposes during planned to be used during 24-25 and potentially into future financial years. And at this stage, we are still holding £6.8 million of uncommitted reserves. We will bring at some point in the next couple of meetings an updated reserves policy in terms of looking at opportunities and usage of that reserves going forward. Appendix 1 in the report details some of the variations, or details the variations in terms of the open delegated budgets from our two partner organisations, the Council and HST side, to the closing position. And I've just noted as well that Appendix 2, the extract of the annual governance statement, is actually last year's, so apologies for that one. The annual governance statement is properly embedded into the annual accounts, but the extract in Appendix 2 is actually last year, so we'll need to get that one, the correct document shared and embedded for that one. So apologies for putting the wrong document into the Appendix 2. And Appendix 3 is the annual accounts, obviously for submission and approval, and then signing off and handing over. So happy to pick up any comments or feedback from IJB members.
Thank you. And Dorothy McHugh.
Thanks, Christine. And just paid particular attention to your last comment because I looked at the areas for improvement and they're all out of date, but I assume that's because this is last year's report.
Last year's extract, yes. The actual governance statement is also embedded within the annual accounts document itself. So it's on, I can't remember which page it's on, but it's about halfway through the report. So the correct
and it's correct
wording, and that's the correct one. Yeah.
Okay. Thank you.
Sorry.
David Cheap.
Yeah, thanks, Bob. And I just actually wanted to congratulate on the actual report itself. My background is clearly finance, and this is really quite refreshing to see. I thought it was a public sector document, which is actually eminently readable and understandable to a layman, and I'm a great proponent of that. And having gone through it all, I think it's laid out, the management commentary laid out extremely well, and everything being there in the appendices for people to pick up. So it's not saying it for saying its sake, but really this is an excellent document and very, very usable. So I hope other people find that as well. Simple as that. Thank you.
Thank you very much. I will pass that on to the rest of the finance team, who have all worked extremely hard over the last couple of months to pull that together. And most of them are actually on the call listening in the background. But my thanks also go to them for pulling all this together at and within timescales and a very strong document as well. Thank you.
Yeah, please do, Christine. Thank you. Thanks.
That's great. And I totally concur with everything that David said. Thank you so much. And Dave.
Yeah, I was also going to kind of just make a kind of formal note of thanks to the finance, or Christine and the finance team, for pulling this together as well. It's not an easy thing to do in the timescales that we've got to do it. So you know, from an accountant's perspective, it's kind of nothing else matters other than accounts over this period. So thanks to everybody, and also members of the strategy and performance team as well, who contributed, particularly around some of the kind of management commentary side of things. So a good all-round team effort for that. So thanks again.
And Christine, in light of you were talking about a change of document, does that mean I have to change the recommendation?
No.
Okay.
Well, actually, the I'm just trying to remember what the recommendation actually says for, in terms of appendix for it. Arlene, I'll take your advice on this one, because obviously it does refer to Appendix 2 for the annual governance statement in the recommendations, and at the moment the annual governance statement that's in Appendix 2 is the old version, last year's version. However, within the governance statement is embedded within the annual accounts for the correct information. So it is published as part of the papers, and we will get that reflected and updated before we issue the minutes of this, but it's just, this will take your advice on exactly what we need to note.
Dave's going to come in first.
Well, Arlene might have a better answer than me, so I was going to suggest that, yeah, we need to change that recommendation at 2.2 because it does make reference to the appendix. So I suggest that we note that the incorrect version has been included in Appendix 2, but perhaps kind of make reference to the annual, the governance statement embedded in the annual accounts themselves, which is correct. So I think, Arlene, I can work with Arlene on formal words around that, Bob, but really we're kind of removing recommendation 2.2, but making reference to the annual governance statement embedded in Appendix 3, i.e., and we can enhance the recommendation at 2.3. If
I'm
that makes
content
any
with that.
sense.
And the minute record will reflect that as well, Dave. So given what's just been said, can we agree the recommendations? I won't read them all out because they're actually within the paper itself. Can we agree the 2.1, 2.3 and 2.4, and with an amendment to the second recommendation as outlined that will be within the minute record? Can we agree that? Thank you. Thank you. That's a great piece of work.
Thank you.
Okay. Right. At some stage, I'll take a break, but I think we've got, can get a few more items in before we move on. Item 9, year-end financial monitoring position as of March 2024.
This one's back to me, and this report is the same format of a financial monitoring report that we bring throughout the year, detailing the projections at various points in the year. This just effectively closes off the financial year, and in terms of providing IJB members with comparative management and operational financial information. Fundamentally, it's the same financial information that's in the annual accounts, but it does have slight tweaks in terms of presentation and a different level of sort of content and analysis, simply because in the annual accounts we've got certain statutory accounting treatment that we need to follow in terms of sort of report reserves adjustments and things like that. So the management position at the end of the year provides the operational position for the year and the operational analysis of the position. So the actual operational overspend for the year was actually £3.7 million, based on that management information side of things. You know, if there's any comments or questions, happy to pick these up. The as before with all of these reports, 4.3 and 4.4 detail some of the key operational variances and drivers for through the year, and the appendices at the end of it provide a level of financial information in detail about different services and budgets aligned to different parts of the organisation and variances for these different parts. So, I mean, happy to pick up any comments and questions. This is just for noting and some of the operational and in year position for 23-24.
Dorothy.
Thank you again, Christine. I note the reserves policy is 2% of budget currently, and we're just above that.
Just above it, yes.
Just above it. So I remember somebody said once it's spent, it's spent. So we'll always have to be mindful of that. We had a cushion. We had a reasonable cushion last year. That might not be the position next year. But I heard you speak about a new reserves policy on an earlier item.
Yeah, it's just it's not necessarily a reserves policy. It'll just be a look at our overall reserves position, aligning it with this delivery plan, transformation work, and bringing just a refreshed paper back in terms of whether we want as an IJB to look at our uncommitted reserves and consider ways of planning to use that over the coming years. So it'll just be we brought a paper to the IJB, I think back in December, about 18 months ago, I think it was, December 22, 23, 20, yeah. So we brought a paper back then in terms of identifying strategic and transformation pots of money. We will be bringing some papers over the coming next couple of meetings in terms of some plans to use some of that. But I just from a holistic review of reserves, do we want to consider setting aside some other pots to support some of that work? Or so it's that's all it was, not necessarily a reserves policy change, but just a use of reserve. Yeah.
Thank you.
Okay.
Any further questions on this agenda item? Okay. Can we accept the recommendations as set out in 2.1 of the cover paper? Thank you. Okay. Christine, I think that's you off the okie for a wee while. Thank you.
For a little while, yep. Thank you.
Right. That takes us now to the item 10, the Engage Dundee survey. Sheila Allen.
Hi, yes, thanks. I'll just, you have the report, so I'll just run through some of the headlines. Just to confirm, the survey was a collective endeavour that was carried out in September and October last year, completed by almost 1,200 residents from all parts of the city. You'll note that almost half of respondents owned their own homes. Most were employed and only a third were on mean tested benefits, although this varied significantly depending on where respondents lived. Findings showed that the majority were struggling with household costs, most notably the cost of food and home energy, and there were significant challenges around a lack of discretionary spend, where respondents, including those who worked, felt that they couldn't afford to do things that made their life enjoyable and worthwhile. In relation to personal finances, a worrying finding was that the majority had used savings for essential costs, borrowed more money than before, and in some cases not bought food or fuel to pay a bill. We found that most respondents preferred services to be delivered on a face-to-face basis, but there was a very high satisfaction where support was offered locally, for example, provision of advice or low-cost meals and activities in communities. There were numerous direct impacts on physical health as a result of not eating properly and living in inadequately heated homes. It was harder for some to manage pre-existing conditions, and some reported developing physical health problems because of their financial position. Respondents made direct links between concerns about money and their mental health, and where people already had mental health challenges, these had often worsened. I mentioned that experience and circumstances varied across the city. We did a sub-analysis of electoral wards, and that showed the areas to the north and east of the city seemed to do particularly badly, although some differences, particularly around mental health, were similar across the whole city. We also carried out a sub-analysis for unpaid carers, and this showed that this group of respondents did slightly worse on most indicators, with the biggest differences being in health and well-being. We've taken the findings across quite a wide range of SPGs now and other relevant groups, and asked partners to consider the steps that they can take to mitigate impacts and prevent crisis moving forward. There've already been several steps taken as a result, including improved messaging on DCC social media channels and their cost of living web pages, moves to developing a public mental health campaign, strengthening of support for families in vulnerable groups such as unpaid carers, and quite a wide range of targeted work in the most disadvantaged communities in the city, specifically the Local Fairness Initiative areas in Linlathen and Stobswell West. That's just some of the headlines. I think the findings probably confirmed a lot of what we knew already, and where we were already investing a lot of our energies around health inequalities. The full survey report provides much more detail than either the committee report or I've been able to go through, but I'll stop there, and I'm happy to answer any questions.
And thanks very much, Sheila. And the report speaks for itself, and actually some of it's quite grim reading, actually. So I now open it up to questions. Dorothy.
Thank you, and thank you, Sheila. Yes, a sobering report, but there's not much new there. That we know about this. We've known about it for a long time. I have a question. It's really about process. Was this an online consultation exclusively?
It wasn't exclusively online. It was online, and it was promoted very extensively across quite a wide range of networks in the public sector and beyond. But we also made paper copies available in communities and had support workers, support community staff available to help people complete the surveys on paper or through a portable tablet. And we had admin support to input the data. We also had our ESOL, so English as a second language, staff working with some of our refugees in the city so that they could respond. And we did focus groups, drawing out the key questions with BSL users as well.
So do you think that was a successful process? I mean, did you reach people? I'm very aware of digital exclusion as an older person myself, and I know, you know, from hearing from older people across the city, and not just older people, but people who basically just can't afford broadband fees. And these are the groups, you know, where often many of the challenges lie. So I'm glad to hear that there were alternatives to the online process. And it is a good report, and I would like to highlight here the work that's done by the welfare. I'm not sure what it's called, Ken. You can remind me. Dundee City Council has a team of people who go out into communities, you know, to help people to apply for any benefits. And they have brought an enormous amount of money into the local community by doing this. And I would really just like to say congratulations to them for the work that they're doing. That's probably a wee bit off message from your report, but thank you, Sheila. Well done. As I say, nothing new here. We know what the problems are, but we need to have it in black and white so that we can address it. Thank you.
Thank you. I thought I'd seen Siobhan Tollin's hand come up. Was that correct? Siobhan, do you want to come in?
Yes, you did. it's Toland, but thank you, Bob.
Oh, sorry.
No, fine. Hold on a second, because my volume's just a bit small. Sheila, thank you for that. Obviously, this is, I think, the second time I've seen this presentation from you, which maybe kind of leads to my point. The first time Sheila gave me and others a presentation was during the Fairness Commission, of which I am a part, and I think that like Dorothy said, this is something that we know, the integration and connection between social issues and health is fundamentally connected. And it seems interesting to me that Sheila's given presentations at the Fairness Commission as well as the Health and Social Care Partnership. But we do have, I think, culture, and this is more a comment than a question, but we do culturally almost disconnect the two. And I think the IJB do some good work in trying to connect those processes. And at the other end, I think that the organisations like the Fairness Commission and the Food Forum and so forth do good work in terms of kind of thinking about the health impact of the poverty of which they're working as well. But I do wonder if maybe there's something more that we can do in that area. Dave, I seem to remember a long time ago we had a kind of vague conversation about this a while ago. It's constantly thinking about how these two impact on each other. And I think the report tells us many things. One of the most harrowing things, I think, is that 50% have no hope. But if it tells us many things, it tells us that deep-seated connection between social problems, economic problems, and the health outcomes that we're experiencing. So this is a kind of vague throughout, maybe, is there something that we can think about doing in terms of cross-fertilising our research, our activism and our actions within the Health and Social Care Partnership, as well as those kind of social organisations that are kind of functioning across the board?
Okay, and I don't think we need to respond to that. I thought that the answers were kind of implicit in the questions. So I'm going to, unless you want a specific answer, Siobhan.
Well, it was more about throwing out ideas, Bob, that so
Yeah.
if anybody's got any kind of suggestions, that might be useful. So it wasn't a kind of rhetorical question. It was more a kind of, does anybody have any ideas of how we can move forward?
Okay, thank you.
See, Dave's putting his hand up.
Do you want? Yeah.
Sorry, can I come in? Sheila might want to come in on the back as well. So yeah, no, really good point that Siobhan makes. Because I think there is that recognition that the challenges are so significant. There's not one part of the system can respond to it and kind of deal with it. So I think one of the other kind of forums that Sheila's probably been to will be the Dundee Partnership as well, in terms of presenting the findings to that. So that is that kind of wider sort of kind of cross sector kind of representation. So it's been to that kind of group as well in terms of the kind of the outcomes there. I think just to give you the assurance from a Health and Social Care Partnership perspective that the findings of this report we are kind of looking at, and we've got the delivery plan on the agenda later in terms of an update, is that actions that we can take or we think we can take that will contribute to that will be reflected in the delivery plan. But you're right, there's something around how the Dundee Partnership then takes forward the findings there and kind of truly starts to make the difference across the city. But Sheila, I don't know if there's anything you want to add to that at all.
Yeah, I just maybe wanted to add the recently formed Child Poverty and Inequality Strategic Leadership Group, which is co-chaired by Audrey May and Emma Fletcher. And I think just we have our second meeting at the end of this week, and that seems to be an additional helpful focus for these kind of cross-cutting discussions and collective action. I think you're absolutely right, Siobhan, that everybody's doing their bit, but that sort of evidence around the collective impact of that has been quite challenging. There's a working group that sits beneath the SLG that's looking at developing measures, collectively agreed measures that will show that we're on the right trajectory to making a difference from our collective measures. So that's quite pioneering work about short to medium term inequalities indicators that are produced and accepted collectively. So that kind of contribution analysis almost is quite complicated, but we miss a trick if we just measure our own contribution all the time.
Thank you for that. A lot of food for thought here. David Cheap.
Yeah, thanks. I think Sheila brought up some really good contributions from how people have gone out into the community and got some wide representation, which is good to hear. But I don't want to teach Granny to suck eggs here, but realistically, the amount of representations with responses we got here is clearly significantly less than 1% of. I mean, it's called Engage Dundee, and we get only 1,000 responses on all of this. And I think, like we do with wearing another hat I've got with the council, is I also query our consultations, and when so much of it is online. And Dorothy quite rightly said about the more mature elderly people who sometimes just aren't able to engage in the manner. And I do feel that these individuals are people who regularly will visit their local libraries for all sorts of reasons, for social, for warmth, for simply because that's their out. That, or obviously local community centres, and most of the wards and areas you talked about have individual community areas, medical centres. So just these pull-out banners that you see all the time, we all use them. The stand-up banners. When we're doing something like this, I think if you've got them in some of these places and bringing community people out to places like libraries and into medical centres to actually allow these people to engage more, it might take the representation levels up a bit. I'm just concerned, that I know it's a cost of living crisis, but it's affected everybody, but in various levels, depending on where you are, who you are, etc. But we all understand that. But we're putting something together that's for the whole of Dundee. We need to think of other ways of engaging more people so that the results actually are materially valid rather than just a small element. As important as that is, but I just do feel it's going to be skewed quite a bit because of the low level of response on it. That's just the point. Thank you.
Sorry, will I maybe come in?
I'm sorry, Sheila. I was just assuming you'd come in there.
Thanks, David. I mean, I would say that this is one method of engaging that was almost like a kind of missing piece of the jigsaw. There's a very large and continuous amount of engagement that goes on in Dundee's communities by local community workers and others. So some of that will be, as you described, in libraries, community centres, in the local supermarket, linking with GP practices or what have you. There's also a local infrastructure. We chair health and wellbeing networks that have that opportunity for services and local people to come together on a quarterly basis, and a representative group of local people that provides comments on developing plans and emerging issues, which complements the fairness leadership panel. So there's a range of data and intelligence that we have. What we didn't have, I think, and one of the reasons that led to the Engage Dundee survey was that wider engagement for people who maybe don't use local services for reasons of working, or actually a lot of the respondents were doing quite well financially, two-person working households and so on. So we didn't have that kind of backdrop of a population-wide survey. So the Engage Dundee survey was an attempt to kind of fill that gap. In terms of numbers, I think it was, compared to some national surveys where the local samples are a couple of hundred people for a city, we were quite pleased with the response, but there are all the caveats for an observational population-wide survey that exist, and we can't look at the findings in isolation of everything else.
Thank you. And that when I was thinking about community resilience, full stop, there's quite a lot of big questions there in terms of what helps communities to cope. Glyn Lloyd and then Dorothy.
Thank you, Chair. And again, I agree. I think it's a very good report, albeit obviously very stark and very sobering. Sheila, just following the conversation on in terms of how we respond to that question about what, so what, now what role might the LCPPs have in this, in targeting groups most at risk, most in need in local communities? And how might they be given information to help them to target those groups as well? I'm conscious there's a section in the report that refers to more data being prepared in relation to the needs of specific groups.
Yeah, so the ward breakdowns, which really did, of all the sub-analysis that have been done to date, that showed the most marked differences in outcomes and experience where people lived was the key issue. So that information has been provided to LCPPs. There's been a presentation to building stronger communities, I think it's in the local leadership group, so that's a decentralisation forum. Infographs that are being developed for use for local community staff when they review the local community plans. Are going to have a kind of review and update over the summer, so the information, the data gathered and the findings will be used as a kind of engagement tool with communities. So that's a key role for the local community planning partnerships. We already have health and wellbeing and health and equalities embedded in local community plans as they stand, but this will give us a kind of a refresh, a more kind of current position from which to develop and update actions.
Thank you. Dorothy.
Sorry, just a last comment on the discussion about the low response. Although I think over 1,100 responses is probably statistically significant, is it not? But I think it could be that in Dundee we're all consultated out, if that's a word. There seems to be a consultation after consultation after consultation. Most of them I see online, and very few of them, available in other formats. But it's like a weekly, consultation every week on something different. And the low response rate, might have something to do with that. People are just saying, "Oh, here's another consultation, and nothing will change, and they won't, won't make any difference." So. And I think the point that David was making about, we need to take this engagement to where the people are, to where the hard to reach groups are across the city, because they're the people we want to hear from, the people that are really struggling, and they're not the people that take part in these consultations, unfortunately. I don't know the answer, but we do seem to have an awful lot of consultations. We're asking a lot of questions, but we're not getting a lot of answers.
Thank
I'll maybe
you.
just make one quick follow-up to that to say that the biggest number of responses was in the east end of the city, which is the most deprived area consistently, because we really went out and targeted folk to help them complete the survey. And just another comment to say in terms of follow-up, because I agree that often people can feel they're asked the same thing and they're not seeing any difference for that. We are in the early stages of organising, I think, the cost of living event fair, where people can drop in before this coming winter and get information on the wide range of supports and services that are available for them. That will be into evening so that working people can access it too. And the key organisers are the Community Health Advisory Forum, which is a representative group of local people that we support. There was over 250 respondents that left their contact details for further dialogue or follow-up, so we'll also make sure that they receive an invitation to the event as well.
Thank you. I think there's quite a lot there, and in the recommendations 2.2, this will be remitted to the Strategic Planning Advisory Group and operational managers, etc., to consider actions to mitigate the effects of the cost of living crisis on health and well-being. And just as an aside to that, this same report came to Public Health Committee of NHS Tayside Public Health And so there are quite a lot of implications for improving population health issues here as well around the NHS public health programmes. So there's quite a lot of players here involved in this, and I'm wondering, you know, in terms of what will follow from this, and what I'm hearing from Dorothy very clearly is there are lots of surveys that keep telling us very similar information, and I'm kind of wondering if what we need to be looking at for our action plan mitigations that will actually do something to help folk. And I would like us to think about how we might use our own tools here as a board, perhaps using a development session of some kind. It's up to us to decide what form that would take as a potential way forward. And I really offer that, Dave, to the SPAG to consider how we might take this forward usefully that would be helpful to folks. And so I'll leave that on the table and we'll come back for further discussion on it. I had seen Ken's hand up earlier on before I moved to Siobhan, and then I'll close this item and then we'll have a break. Ken, did you want to say anything here?
I was just pondering on the point that David made, I suppose, and Dorothy mentioned it as well, the statistical usefulness of having 1,100 responses. We've currently got an election campaign, and the opinion polls routinely sample, 2,000 out of a population of 50, 60, 70 million is considered to give a fair idea of how people are going to vote. So we're never going to get 147,000 people responding to a survey. So I think it tells us, I guess, what we already know, which indicates that probably that survey is useful. That's why I put my hand up and down a few times. I just wasn't sure if it was a particularly good point, but yeah, I don't think that it's necessarily not useful just because it's 1,128. Given that's how opinion polls work, it's a relatively small sample. But what you would need to do, it's interesting that most of them came from the East End. You would need to make sure that it was that survey was refined in such a way that all sectors of the population were represented in proportion to each other. It was just a few thoughts I was having. That's why my hand was going up and down. I'm not sure if I've made myself particularly clear.
No, I think that's fine, Ken. I think your point about a lot of the responses coming from one distinct part of Dundee is well made. And Siobhan, final comment, and then I'll close this item.
Thank you. Just for interest, anything less than 1,000 in a poll would not be considered an appropriate outline of people's opinions. So if you're looking at opinion polls, you really need over 1,000 in order for it to be kind of useful in terms of gathering data. But my point is a couple of things, and Sheila, this is a question. I think 1,100 is actually good, but in comparison to others, how does that fare? Because people don't often fill these things in. So I think that for me, that is a good sample. But in terms of kind of maybe just managing that data, how does that fare in terms of other good practice polls and data? I think as well, I'm going to make a point before you come in, Sheila, thanks. I think to be fair, this is not old information, and this is not a repeat of information. This is new information. This is post-pandemic, and this is a snapshot of where we are in a post-pandemic society. And I think for that reason, it is absolutely vital. It's not a rehashing of old information. It might tell us things that we've already guessed, but what this does is it gives us data and it gives us information to understand very clearly where we're at. My understanding is that this was a pilot in Dundee, is that correct? I don't know if that was correct, but it is new information because we're living in new and unprecedented times, and we needed to get that data in order to understand how we move forward.
Okay, thank you.
Just a really quick response to that then. Public Health Scotland, NHS Tayside Health and Equalities team and the Council's Research and Information team assisted with the production and the analysis of the data. So all the numbers when I'm reporting are valid. We did do a similar survey under COVID, which had fewer responses. My hunch, I can't really accurately answer the question around whether this matches what other areas are doing, but my understanding is that nearly 1,200 was a pretty good sample and a valid sample, and mostly, apart from a bit of an uptick in East End that had more responses, across all other wards in the city there were similar numbers as well. So I hope that's kind of helped to answer that question a little bit.
Thank you very much indeed. Okay, the recommendations are fairly straightforward, and we've noted the report, and this will be remitted. Sorry? Sorry, who's speaking? I think someone's right. Okay, thank you. And this will be remitted to Strategic Planning Advisory Group, as I said, and operational managers to look at mitigating actions. So I think these recommendations are fairly clear, and I keep my offer open that we should be perhaps looking at how we can developmentally take some of this work forward, as well as the ordinary programmes of staff. Okay, thank you very much. Let's take a 10-minute break, please, and then we'll come back to the item 11. Thank you very much indeed. Thank you. Let's now move on to item 11, strategic shift to advanced nurse practitioner-led frailty pathway. Lynn Moorman.
Hi, thank you. I want to just present this paper noting and hoping for approval of the proposal to fund a third lead ANP post. We already have 2 in place, and that's to support the ongoing development of our whole system frailty model. With a slight additional uplift for additional project management support in order to support the evidence gathering and data around this project. The posts will support the supervision of the entire ANP workforce across the partnership, and in terms of the competence framework and in relation to their 4 pillars of practice and how we ensure that they're supported appropriately to work to the ceiling of their competence level. That will include 22 ANPs currently across the city, with a further post to be added from within the existing MFE medical budget, and that's in line with our strategic the strategic approach to some extent moving towards an ANP-led model and away from the more traditional consultant-led models. It supports the overall urgent and unscheduled care programme of improvement work, both locally and feeding up into the national Scottish Government programme around urgent and unscheduled care. What I'm asking for is that the board approves this additional funding over the next year from the Transformational Fund.
Thank you very much indeed, Lynn. Questions from the board? Beth Hamilton.
Hi, Lynn. Good to see you.
Hi, Beth.
This, I mean, obviously, I'm very supportive of the whole process of the advanced nurse practitioners, and I would be really supportive of that additional bit of money to look at the support for project. As I think you would expect me to say that, but I think that is key and one of the things we're losing. The one thing I was just going to ask, and maybe this is unfair, but it's just we're looking at the clinical element of the frailty model and the really admirable trying to prevent admission rather than just solely focus on delaying discharge. Have we got the social care support around that? Because we can fling money at if we can find, not fling money, sorry, excuse that, Jim. If we can allocate some of the transformation money into the clinical care, i.e. the NPs, which I wholly appreciate, is there going to be sufficient can go in to support that social care environment around?
So I guess for the first time ever, Beth, we're in the best situation that we've really ever been in relation to social care. because of the improvements that have been made in that area in the last year, and most of those improvements have been presented to the board previously. So we're now in a position where we've reduced our unmet need in social care by, I think, around 4,000 hours. It's incredible. So we are now, and I appreciate that that's been overfunded as well in order to meet our targets, but we are in a position where we're working very collaboratively with social care to identify really early people who both could be prevented from being admitted during that acute exacerbation of their illness at home, but also those who can be turned around at the front door of the hospital and sent home more quickly with support, care and treatment, so both social care and clinical care. And that's in recognition of the clinical evidence that people, particularly frail older people, do better in their own homes, and they don't then become more dependent as a result of hospital-acquired delirium, etc. So actually the social care service is working excellently well alongside this clinical development, and we have created better links in the last year.
That's great. Well done, Lynn. Thank you very much.
Thank you. Dorothy.
Thank you. I don't really have a question, Lynn. I'm just so glad to see this report. We've been talking at the IJB about transformational change for so long, and we had set aside some money for it, and I'm, delighted to be able to support this application. I mean, anything that will help frail or older people to stay at home and get care closer to home has got to be applauded, because you're right, that's what they want. They don't want to be in hospital. Nobody wants them to be in hospital. So I'm very glad to see this, and I'm happy to support it.
Okay, thank you. It sounds as though there's a green light on this one, Lynn. If there aren't any further comments, I'm just going to move to the recommendations. And we note the transformational nature of this proposal and its contribution to the strategic aims of continuous improvement of unscheduled pathways and process as outlined in the report. And we approve the release of funding from ring-fenced IJB transformation reserves to the value of 92,000 to support the proposal, as detailed in section 3.1, and instructs the Chief Officer to issue the direction as attached at section 8 of this report to NHS Tayside. Do we approve these recommendations? Thank you very much indeed, and thank you, Lynn. Look forward to this further development. Great role. Okay, that now takes me back to Jenny Hill again, the annual report of the Dundee Health and Social Care Partnership Clinical Care and Professional Governance Group 23-24.
Thank you, Chair. As you've said, this is our annual report in relation to our governance arrangements. So it just outlines the detail of how those report into other fora, the meetings that we've had, and our arrangements around particular things, including service area updates, risk management, feedback, adverse events and inspections, as well as the improvement actions that we've been taking in relation to our governance arrangements, and I'd highlight in particular the move towards care opinion and the risk management work that we've been undertaking alongside trying to improve our management of adverse events. Happy to take any questions in relation to the report. There's quite a lot of detail in there.
Thank you. There is indeed. Questions?
Also happy to not take any questions in relation to the report.
I don't have any this time, Jenny.
Beth, please.
Thank you, Bob. Hi, Jenny.
Hi there.
As Chair of Care Governance, I'm pleased to see this. Lots of details though. But there was one thing that struck me in the report, which is just the current position within the Paediatric Dietetic Service. It was mentioned in the report that you had been collaboration through professional lines and excellent multidisciplinary work and supported the provision of safe care through the challenging period. Is that challenging period moved on, or is it still current?
My understanding is that's still currently one of our risks and that we're trying to continue working our way through that one, Beth, unfortunately.
No, that's okay. It was just to see if there was still ongoing. But no, it's good.
Yeah, we can keep you up to date with that.
No, that's good. So thank you for the report. I'll no doubt see it in another iteration at some point somewhere soon. Thank you.
Thank you.
Martin Sloan and then Kenlin.
Thank you, Chair. Just a very quick question about the overall report. I must say it's quite good. I noticed a number of the areas that you're working in crossover very much into the realm of unpaid carers and the work that we do in supporting the people that we care for over the period. And I was just wanting to know, is there a method, a current method where the stuff that carers are doing is fed into the group, and is there a structure or a mechanism for carer, either the carer lead or other carer professionals being involved in part of that work?
Yeah, so that would come up in a number of areas in relation to unpaid carers, but particularly that's a routine part of inspection methodology. So there's a feed in there, also through kind of feedback processes and things like that. So yeah, the opinions of carers as part of that overall governance framework are very much part of that, Martin.
So I just wanted to ensure that was the case. Thank you.
Okay, thank you. Ken.
Yeah, just in reference to the section on the Dundee Drug and Alcohol Recovery Service, I think what I'm seeing, not necessarily in Dundee, but what I'm seeing in the press recently is unfortunate predictions that the number of drug-related deaths nationally might be on the rise again after a drop in the last year or two. So I think against that background, it's really important that we continue to focus our efforts in Dundee to improve services. I noticed there's a slightly woolly section about Constitution House and the move out of Constitution House, which was identified by the Drugs Commission some number of years ago now as being wholly unsuitable for the needs of people with drug and alcohol, well, particularly drug problems from that service. And I guess I'm disappointed that it's still really quite woolly in terms of when this is going to happen and when they're going to move. I think if this were a children's service or a service for older people, would we really still be having a woolly paragraph like this years and years after it was a key recommendation from the Drugs Commission that we get the service moved out of there somewhere, not just one place, but to more suitable locations? Maybe we could have a more concrete update on that sometime soon. Thanks.
Yeah, I think we're due to bring back a premises update generally fairly soon, and that'll come as part of that. And we have been kind of working on our strategic needs assessment for substance use services, because I think the idea historically has been, well, you just move Constitution House into another one, and that's probably quite a risky scenario. So working on the service modelling and how we could move out into people's own communities. I think DDARs are currently operating out of 11 other areas as well as Constitution House. We've also been working to get the shared care models up and running with a number of GPs across the city, including most recently Newfield. So instead of having that kind of accommodation-based aim of you move out of Constitution House, we're phrasing that in terms of service methodology design. About this is about people having choices about where they receive their treatment and people not being forced to go to Constitution House. And I think that sets us in a better longer term direction, so as we're not just, repeating the same problems again.
Yeah.
So that's not the concrete update that I will bring you. That's the interim update.
No, and it's really good to hear. I mean, it's always been the case that, I mean, all services haven't been provided from Constitution House, and it's certainly good to hear that there's at least 11 sites where services have been provided where people need them, but that remains the hub, and it's kind of emblematic, I think, of the lack of attention that we've maybe paid over the years, which I don't think is the case now. I think it's a key priority, but I'd really like to see some movement on this. But
Yeah,
I think
sure.
I've made my point. Thanks.
Okay, thank you, Ken. Siobhan?
Thank you. Actually, just really a way to say what Ken had just said as well. I mean, you know, the Drug Commission, Jenny, obviously did not recommend that, you know, Constitution House moves from one place to another. The whole point of that strategy was to, as you say, kind of like take these out and put them into community and diversify that support structure. So that was there within the Drug Commission, I think, at that time anyway. But it has been a while, and I know that there's a kind of sense of, but it's not about the building, but it kind of is about the building. And that's the kind of point where I'm kind of agreeing with Ken quite a lot, is it is emblematic, it's symbolic of how we treat addicts in that service as well. So it's almost becoming like a physical and metaphorical anchor around in that respect. So it would be really good to get an update on that and how we're moving forward. The last I heard is that some premises were being looked at, but I think from memory that was about a year ago.
We had been looking at whether there was an option around Wallace Town to move some of that. That option isn't available to us, so we are now looking at another couple of things. I understand what you're saying about the anchoring of that in Constitution House, and I think you're right in relation to Drug Commission. That wasn't their recommendation. I think that's more how it's been kind of heard since then, is that, you know, it's about getting out of Constitution House into another one. I absolutely agree, though. It's about dispersing services and moving away from stigmatised services.
Oh, thank you, Ken. Oh, sorry, I thought you were coming back in again, Ken. Thank you very much. Are there any further questions? I think one of the key areas I was looking at was staffing and the number of operational risks that are around regarding staffing workforce. And that seems such a key issue. And I know that the Performance and Audit Committee will be looking at what are the outcomes of these staffing difficulties, Ken. So I think this is one we really need to keep an eye on in terms of what's happening because of the staffing difficulties.
Yeah, I think though, one of the encouraging things that I've learned recently, I think it was from the last pack actually, is that morale is higher amongst DDAR staff, and recruitment is improving, and retention of staff is improving, as it's seen to be such a vital and forward-looking service, and that's not where we were, say, 2-3 years ago. So there's really encouraging signs there. And by making the point that I've made this morning, I just want to keep that momentum going, because things are going the way we want them to at the moment. Thanks.
That's good. That's so good to hear. And Jenny, I dare say you want to back that up as well.
I think that Councillor Lynn's covered an awful lot of what I wanted to say there. Yes, recruitment and retention have both improved. We're in a radically different position. And I think it was the national report in relation to feedback from staff about the implementation of the MAT standards. We'd had some informal feedback that Dundee was doing better than other areas in terms of their staff's kind of opinions around that. So there are some very green shoots in the service.
Okay.
We've reduced the risk level for those quite significantly in the governance arrangements.
Okay, thank you. That's helpful. That sounds a positive ending for this particular item. Can we just look at the recommendations in 2.1, 2.2 and 2.3? Do we accept these recommendations? Thank you. Let's now move on to annual complaints and feedback report from Claire Lewis.
So our annual complaints and feedback report, I suppose what the general as we've kind of fed back in our quarterly complaints performance reports, is it's quite steady. There isn't a lot of change in the way in our performance for complaint handling. We've had a slight decrease in the total number of complaints that we've received. In terms of where we focus on timescales, whether we're handling complaints within the timescales. And as you can see in section 8, actually we're not. We do get about a third of them for stage 1 within the 5 days, and within stage 2 we get around about a quarter of them in total. But that's not to say that we don't look at complaints very thoroughly. The largest number of complaints that we have is in our mental health services, and they are often very complex. We're working with the NHS complaints and feedback team, having regular meetings with them to manage them, to make sure that we're managing them. And I think it's about the complexity, but also the culture of looking at these complaints very thoroughly and working with people till they're resolved at the outcome. Whereas if you're just hoping to get them closed within timescales, you might focus on getting the complaint outcome out and then making sure that the plan for that person is kind of implemented at a later stage. So it's a similar report to what we've been saying in our quarterly complaints reports. Where we uphold a report, we look at our planned service improvements to make sure that we're making improvements to systems. Also, I'd say that the number of complaints that we have that are referred to the Scottish Public Service Ombudsman are very small. Just 4 have gone in the past year. So I think we get the feeling that we are working closely with our complainants to make sure that they are happy with the result, that we're looking at the complaint for them. So even if we do not uphold the result, they will be assured that we have looked at it thoroughly. And we have a number of compliments, but I think the thing we're very enthused about is our development of care opinion, so that will be rolled out in the next month or so. We've mapped all our service areas and we're getting the training organised, publication materials, and we'll be working with comms to get that rolled out in Dundee.
Thank you so much, Claire. Questions for Claire? Dorothy, and then Liz.
Claire, thank you for this. I see that we have a trend, we're showing a trend over time for total number of complaints, but that information is not available for complaints closed within the time scale or complaints upheld or at different stages. Will we get that information at PAC?
So we used to provide the SPSO had, a couple of years ago, the SPSO's report that they want, statutory way that we had to report, was very, very detailed. And we had great difficulties getting all the information from the NHS complaints and feedback team. So we did used to provide that, but we could look at trends for the complaints closed within timescales. So we could do that within that. But yeah, the way we've reported has changed since the SPSO dropped the number of categories that they wanted reported on.
Okay, I hesitate to add to your workload.
Well, it should be possible because we have that information, so I can go back to our customer governance officer and ask for that for trends to kind of be.
And that would come to PAC. Would it be more relevant at PAC?
Yes, yeah, but we could add it into the annual complaints and feedback report as well.
Thank you.
Okay, Liz Goss.
Hi, Claire. This paper concentrates a lot on timescales and statistics, which is obviously important. But I think many people complain because they want to see service improvement. So I wondered if there was any way to just enhance that section, because that seems relatively short for me in terms of complaints are a great way of driving forward change and making the service more fit for purpose. Does that information appear somewhere else in some other report, or
no? It's so the number of so for social work complaints, it's quite a relatively small number actually that we're pulling on. So you balance that between kind of information that's might make somebody identifiable for a particular issue. So there's that difference between the system-wide things, such as people are on a waiting list or they're not getting access to a service, which is we understand that, but sometimes we have really individual issues that are, so there's that. The information for NHS complaints is kind of gathered by the NHS complaints and feedback team, and we've asked for that information to get that reported back again, but actually they've said it's difficult, it's held in a different part from them, but we could do. But what we are hoping that the care opinion is going to give us much more qualitative information as well, so that we're hoping it's really going to kind of enhance our qualitative response that we're able to kind of share with you as well.
Thank you. That's helpful. I just know I find it helpful, and sometimes we get into settings like hospital settings. You said this and we did that. I find that quite helpful because it means somebody's actually paid attention and there's been some service improvement. I think that's what people want to see, but that's reassuring. Thank you.
Beth Hamilton and then Jenny Hill.
Hi Claire, lovely to see you. Yeah, probably the last discussions sort of covered my questions. I suppose as you would expect me to ask you, it's how's it all coming together with working with health and social care in the sort of widest sense? I know that care governance, which I'm involved with, we hear the complaints and compliments, and we've got a new name now, and for the life of me I cannot remember if it's something liaison or, but taken away from it being a complaint service. Is that all working and our systems talking to each other now, or are we still reporting the things in isolation?
No, it's still very much separate, I would say. So the complaints procedures are separate. So it's an NHS complaints procedure and it's a council complaints procedure. Where we have integrated complaints as well, we try to ensure that we're handling them, as a one, a cohesive response. But more often than not, our NHS complaints are kind of scattered between us, NHS Tayside, and maybe even another partnership. So when we're responding to those kind of complaints with multiple services, we're providing our response. But in terms of us getting information from the people we need it from, it's easier for us to pull it from our council systems than it is to get it from the NHS complaints and feedback team. That can be quite difficult still.
Okay. Good. And just wanted to say, great news to see about the care opinion. I think you'll find a huge difference. The areas that have been using it, particularly that's one of the tools Perth and Kinross use, and it's pretty powerful. So well done, and that's good. Look forward to seeing how that rollout progresses.
And I think what we've been doing with these reports is we're telling you the same information, mental health, but actually we need a tool like care opinion to really dig down and get those the real information about what we're doing and to get some more qualitative information out there for you.
Yeah, and what's so important, which I see you're doing, is making sure that staff responders are identified, because there's nothing worse than people putting their opinions and nobody acknowledging and responding. So well done. I look forward to seeing that. Thank you.
Thank you.
Okay then. Final comment from Liz Goss.
Sorry, that was an old hand that I left up. Sorry, apologies.
No, that's okay. Very much hear what people are saying about care opinion, and actually I think, Claire, it'd be really helpful at some stage where we actually have a presentation from care opinion as to how they actually operate, because it's very useful for board members to understand how information is treated and how correspondence is treated, and how improvements are also suggested within some of the correspondence that care opinion receives. So it's well worthy of the IJB hearing a presentation on care opinion once it's set up. It's incredibly useful for understanding the difference. And we'll let others work on the arrangements with NHS Tayside, won't we, Beth? Thank you.
Thank you.
Okay, thank you. That's fine. The recommendation is we note this analysis. Can we just agree that? Yep. Thank you. That now takes us on to, thank you, Claire. That now takes us on to Dundee Health and Social Care Partnership Delivery Plan Update, Dave Ferry.
Okay, thanks, Bob, for this. So again, this is a bit of an update to the IJB in terms of how we're progressing with the annual delivery plan. We've kind of referenced that a couple of times already in this meeting, some of the issues that we kind of picked up within that. So I think probably kind of a couple of things to kind of pull out around this side of things is that we are kind of really doing this. There's no real blueprint for this for us to follow. So this is something that we are developing more or less from our own perspective. We haven't kind of seen any other examples that we can look at and say, right, we're going to copy that across. So the team's kind of developing this with kind of full engagement with other parties on how we should present it and what should be included, etc. So where we are at the moment, and you'll see kind of in section 4 point, just your IT stops when you don't want it. 4.2 of the report kind of sets out kind of the approach, and I think again one of the kind of key things is in terms of a delivery plan could kind of cover so much in terms of the detail of what we're actually doing as a health and social care partnership. So we're looking to kind of focus it more on the areas that will kind of have the biggest impact on our strategic plan itself. And that includes a kind of rolling up of the transformation kind of projects and the work that's happening around transformation. Again, with this something we've talked about a number of times in our IJB around how we kind of set up our transformation program. So that'll absolutely be reflected in the delivery plan. Looking at our risks, so the IJB risk register, what are the kind of key areas from that we need to be focusing on. As well as, of course, the kind of the bread and butter, if you like, in terms of meeting our statutory obligations. So things that have to be done to meet those statutory requirements. So that the kind of approach around that is very much how we kind of see this, see the delivery plan developing over the piece. Excuse me. We are looking to, of course, kind of look at other partners in terms of what they're doing and kind of making sure that we reflect some of those kind of other kind of key priorities within our own work streams. Excuse me, that'll include the NHS Decides kind of delivery plan that's being developed at the moment as well, while keeping an eye on what's happening at a national level too. National Care Service, of course, we need to kind of keep an eye on what's happening around there. We have also kind of recognised that some of the other companion documents are still kind of working through. So we've got the housing contribution statement, which again is part of our statutory requirements to consider as part of our strategic commission framework. So that kind of work is underway with our kind of neighbourhood services kind of partners around that. And we also have performance framework and resources framework, which will fall out of the delivery plan as well. We have committed to providing the delivery plan to the IJB by October. That kind of did give us a bit of space whether we might make in August, but I think kind of particularly given our previous conversation about the action tracker, that I think we'll stick with October and that commitment's there that we'll bring something to the October board meeting in terms of a delivery plan. So a bit of an update in terms of where we are, but again, happy to take any questions, observations if anybody has any.
Dorothy.
Thank you, and thank you, Dave. Section 4.2 speaks about the strategy, the plan for excellence, which I think was launched in June 23. And the delivery plan is to evolve over the next 2 years from now. So that's 2026. Maybe I've got this completely wrong. So that would be the delivery plan finally 3 years after the plan for excellence. Have I got this all wrong, David?
So the plan for excellence is a 10-year framework. The original intention would be that within that, because that's kind of quite high level, we would kind of have an annual delivery plan would sit underneath that to support the achievement of those priorities set within the 10-year strategic plan. So it's the annual reflection of what we'll do to kind of meet those strategic priorities. So the original plan was last year we would have our annual delivery plan would have been developed. Because of a number of different factors we've kind of highlighted in terms of resources and kind of adult protection inspection, we didn't actually manage to do that at that stage. So this is us kind of giving a focus for this is the 24-25 element of the annual delivery plan that will be presented to you at that stage. Ideally, what we would have would be an earlier iteration of that would come through. So that's what we try aim to do for 25-26. And then so every year of the strategic framework, we will present an annual delivery plan to the IJB. That's the intention.
But the first one that we will see will be when? So
that'll still be a 24-25. That'll still be a current year delivery plan.
When will we see that?
By October.
Okay.
Yes. So that's what we'll commit to deliver by October.
Yes. Okay. Thank you.
I think you actually said at the latest. I think, Dave, was our goal.
At the latest, but in terms of the minute, it will be the end of October. Thank you.
Okay, we will hold you to that. You know that. Thank you so much. Thank you, Dorothy. Are there any further questions around this area? Okay, thank you. Well, I think we just note the recommendations and it's very clear about instructing the chief officer to bring forward a final delivery plan. I think that's really clear, Dave. Thank you. So we accept these recommendations, Dave, and thank you so much indeed. Look forward to that. We now move on to the Category 1 Responder Annual Report 23-24. Angie Smith.
Thank you, Chair. Apologies, I'm just in post and this has come into my portfolio, but I have been involved in some of the work previously with Diane McCulloch. So there has been quite a lot of work that Diane has taken forward over the last year, which is in the report. There has been a few changes in terms of how we manage the rest centres and the use of volunteers. And the last rest centre that was set up for Storm Babette was quite successful in developing that model. I'm meeting with Steve Blythe at the end of this month, and I will get up to speed with what needs to happen next in terms of making sure that we do deliver on the asks within the paper. If there's any specific questions, I will try to answer them.
Thank you, Angela. That's blissfully short. That's excellent. So you've got the full report here. So now who wishes to come in? Well, I'm going to start off actually and just say congratulations around the Oscar Award for Ukraine response. Well done.
I can't take credit for that one. That was sitting within Diane's service when she was here. So, but I will pass that on to the team.
Thank you so much. Okay, questions. I don't see any questions coming. I was just going to ask, it's probably a simple Charlie question, really, is that what elevates something up to a resilience response? What makes an ordinary event de-escalated, say like a storm Babette or something like that? How does that, how do these things kind of come about?
There are different categories within the escalation process. So the police in general are the ones who would normally tell us what was escalated to which stage, but we obviously have our own resilience planning around each of the partnerships. We have our own business continuity plans that we would do. So the last resilience planning training that I attended, they used a weather event just like Storm Babette as an example. So while it's a yellow category warning, we would be looking at our local resilience planning, making sure we had everything in place, staff were aware of what they needed to do. We would make sure there was information going out. If that escalated up to an amber, then we would look to start escalating potentially to a sort of silver command to start pulling together some of that coordination and making sure that we are prepared in case we do need to escalate. But when it goes to a red, that's when the full resilience planning network would kick in. That's a very basic summary, apologies.
No, but one of the things that strikes me about these is that you're very dependent on communities themselves to be part of this response, because volunteers figure highly in most of them. And I think that's something that we often forget. It's not just about emergency services. Thank you. Beth Hamilton.
Well, good morning, Angie, but it's afternoon now, isn't it? Just wanted to say that it's a really, really good paper, quite comprehensive. I am aware that some of the level of the work that goes on around this kind of planning, I'm glad to see that there's a lot of collaborative work going on across Teesside, including the Health Board and other areas. So well done. And I feel secure that we're going to be looked after in an emergency. Not quite the post-apocalypse, but something comforting. Thanks.
Yeah, and possibly just another example, Chair, around what you just mentioned there. There is a lot of formal planning and training that goes into staff groups within each of the partners in the different resilience groups. Some of that is local in terms of how we plan, as I say, for very basic things like the winter planning. Some of it is much more like there was a big air exercise a few years ago where there was actually a multi-agency response looking at how would we manage if an aircraft crashed. And it involved actors and social care workers, social work staff, nurses, medics, police, ambulance, the full range of practitioners. And it was a really successful exercise in making sure that we did understand fully the complexities that happen within these scenarios. So although we are quite reliant on the communities at times, sometimes it's actually the communities that step in and take it away from us. One example was when there was a gas leak in the east of the city. We'd set up the rest centre ready to take people and found out that the local public house had opened their doors and we weren't actually needed, so we were stepped down. So a lot of the time it's a partnership approach, and yeah, the communities are great in supporting us with this, but we do that other work in the background.
No, appreciate that. I'm so glad I asked the question now. Thank you. Okay, thank you very much. Well, the recommendation is we note the contents of the report and we expect to see a further report in 12 months' time. Thank you so much, Angela. Okay, thank you. That now moves us to financial regulations. Christine Jones.
Thank you. Yeah, back to me for this one. So under sort of governance arrangements, we are required to have a financial regulation document. It's under sort of legislation, good corporate governance. The original financial regulation document was drafted and approved back at the time of the inception of the IJB, following the integration scheme being revised a couple of years ago. We're now formally coming with an updated document to incorporate the financial regulations that have been reflected through both the changes in the scheme of integration, but also even just learned experience over the last sort of 6-8 years or so. So the attached document in Appendix 1 is noted there and asking for the IJB to approve this and adopt this one. It does include the track changes to make it easier for yourselves to read and see where the changes have been implemented or are being proposed to be implemented. And just worth noting, as in detailed in section 4.4, These financial regulations are specifically for the affairs of the IJB, for wider delivery of operational services. The Health and Social Care Partnership Services, we also have to operate under the financial regulations or standing orders of our partner bodies, either the council or NHS Tayside as appropriate. So this is specifically looking at IJB financial regulations and governance inside there. So it's for noting and approval. Thank you.
Okay, any questions before we move to approve? Nope. Can we therefore accept the recommendations to both note and adopt the updated financial regulations for officers as detailed in the appendix? Yes. Okay then. Thank you very much, Christine.
Thank you.
That then takes us to the scheme of delegation, Dave Ferry.
Okay, thanks. This kind of follows on quite neatly from Christine's paper on the financial regulation. So yeah, once again, part of our overall governance arrangements, the scheme of delegation kind of follows on from the legislation and integration scheme. So it kind of sets out the responsibilities of the IJB and officers of the IJB, as well, specifically the kind of chief officer, chief finance officer, and also the chief social work officer. You'll note in terms of the kind of changes on this one, they're very minor, reflect the kind of the updated integration scheme, which was approved, but also reflect changes or kind of updating from a Dundee City Council perspective on the role of the chief social work officer. So we've kind of recognised that and incorporated that into our own scheme of delegation. Just to note that for both these items, the financial regulations and scheme of delegation, we will be kind of touching on these a bit further in the development session around governance tomorrow. That's for today. That's we're kind of asking that you support the changes to the scheme of delegation.
Thank you very much, Dave. The paper is fairly clear. Any questions on the paper? No. Therefore, I'll move to the recommendations that we note and adopt the updated scheme of delegation for officers as detailed in the Appendix 1. Yes, thank you. Okay, thank you very much. The item 18 is the meetings of the Integration Joint Board attendances for information. I often find that people sometimes ask questions about these, like, I was there or I wasn't there or something like that. That's usually what happens. Okay, we note that, which then takes us on to, now David Chief has asked for any other confident business, and normally there's a protocol around about this, but because we've got plenty of time today, I'm going to accept, David, as long as it's not too complex, an AOCV. Dave.
I hope it's not, no. Thanks very much for letting me do this. It's just, again, new member, really, and I'm looking at the last item, again, looking for the next meeting, and I'm just concerned with the continued assumption that all meetings are going to be remote with the Integrated Joint Board. I struggle and have again this morning with my signal at times, and I miss some individuals' contributions or parts of their contributions. I just wonder on people's views about meeting in person, oblique hybrid, perhaps every other meeting or once a quarter or whatever. I mean, Sam Riddle advised me that he had been, I think, a member of this committee for about 3 years and was yet to meet any members in person as on the committee. I don't think that's best for operation of this committee. And I have to say, quite often we don't even see people because they're hidden behind cameras and things. So I would like to advocate that we actually move to getting together sometimes, at least, rather than just assuming anon that this is going to be a remote meeting.
Thank you, David.
It's just my view. I'd like to know what other people think. Thank you.
Yeah. Ken and Dave and I are already on the case with this particular issue. Ken?
Yeah, I was just going to say that's 100% my view as well, David, and the sooner the better. I think we need to get a move on. I mentioned the pandemic earlier in the meeting and why there was such a delay. It's another area of activity, and I don't know why Well, I share some responsibility for it clearly, but I think part of it is the fact Dundee City Council, for various reasons, hasn't yet returned to face-to-face meetings, although I believe will so soon. So I think it's kind of been to do with maybe the technology not being available yet at Dundee City Council level, where we'd probably have our meetings as we used to in the past. But I think these problems are nearly resolved. So given that, I think the sooner the better we get back to face-to-face with a hybrid option, the better.
Yeah, thank you. And Dave, I think you got the message on this one. Dave, do you want to come in here? And then I'll
Yeah,
take Siobhan.
I think from the conversation that Ken and Bob and I had was, I absolutely recognising the point that you made, David, was that until we're in the technical side of things have been kind of resolved within Dundee City Council, and I'll kind of pick up with committee services on that one shortly. We did commit to holding the development sessions as face to face, because they don't necessarily kind of need the same sort of kind of level of formality around them as well. So obviously the one tomorrow, because of the timescales, is kind of been set just as a kind of Teams meeting, but we did think that the development sessions will give that opportunity as well for the relationship building sort of kind of face to face, before, during, and after this sort of session. So absolutely kind of on that one, and we'll kind of say report back in terms of the formal meetings, and once we've got a position on that.
Thank you. We will get back to you on this. And Siobhan.
Yeah, thank you. I appreciate the the kind of desire to move back to in-person, and I'm not necessarily averse to that. But I do think that we do need to think about it in terms of hybrid. The issue, I think, I mean, this is just my personal issue, but, there's lots of people with other issues. I mean, I work on a Wednesday, and that takes another hour out of my timetable to get to the venue and back and so forth. So it's like when there's other commitments, it becomes problematic. But I think the problem is sometimes that hybrid often doesn't work as well. There's an element of feeling a wee bit like a spectator when you're online. So it's maybe just thinking about how we manage it. Rather strangely, the kind of hybrid system in my other work works much better than anything else I've seen. But it's maybe just worthwhile thinking about that and trying to get the balance right.
I agree with that. And what I do find, though, is just my own experience, is that when we do have the opportunity to come face to face, it does encourage more people to come in, even though it's quite difficult, actually, for some people. And I live in Perth and Kinross, and the issues of rurality there are quite significant in terms of that. But the tendencies have always been very good. And just simply because people really want to engage, and I think that matters. So I think that's something we all need to take away with us. So David, thank you for raising this issue, but as you know, we're already looking at this quite hard.
Bob, can you just come back one thing, just to put Siobhan's mind at ease on this one. We Angus Council has adopted it last year, and it's incredibly successful. And the people who are coming in on hybrid, really, it feels like you're in the meeting, absolutely in the body of the meeting. It's extremely successful. Size of screens. I know in NHS Tayside in the boardroom, if you're on hybrid, it feels like you're a million miles away. But in council chambers, if that's what you use, it's extremely good, and you really and I'm with you completely. I would propose it as being hybrid, but encourage many people to come in every so often as they can. That'd be my view. Thanks again.
Well, let's let Dave take that away with Roger as well, and look at just what the implications of all of this are. But certainly, as far as I'm concerned, I certainly want to see more people round about me, and I think that particularly applies to people who are kind of not voting members, but find it difficult to have that exchange, I would say. Thank you very much indeed for that. Before I move to the date of the next meeting, I want to just thank Arlene for just sending out the development dates to me, and I think that's gone to everybody's diary. That's really helpful, and I will try and be there tomorrow for the 2 o'clock. I'll speak to Beth about another meeting. And just one other thing that Ken and I had a discussion round about the agenda itself looking ahead, and we're very keen that the IJV has an annual work plan that we can predict what is going to come up at various dates throughout the year. It's already set that we will have either meetings once a year or twice a year on certain topics, but we feel that we need to see before us what will actually come up, and that you will be able to see this at every opportunity when IJV meets. So that's an action. I expect to see that to start from the next meeting. So just to say that that is going to happen. So thank you very much indeed. I've really enjoyed this meeting, I have to say, and it's a great welcome to Dundee again. So the next meeting is to be held on the 21st of August. So I look forward to seeing you all again. Beth?
Yes, Bob. Sorry, it's just when you were doing any other business, I thought it was worth just mentioning the you had distributed the report, the equality report, and the carers report about the IJB and membership, etc.
Yes.
And I just wanted to acknowledge Martin and Christina's input into that, and just that's something, Dave, when you're looking for your agenda of topics for your development events. I think it was a really good paper, and it's something that I think would be valuable to use as a framework for discussions in one of the development events in the future.
Well, that's something I'd like to take up with the Chief Officer, and how we can actually work on how we can implement some of these recommendations that are acceptable to the IJV. And so that's what I would like to start focusing on. And just thinking ahead, although the National Care Service is a long way off, I do expect to see far more participation in future. So I look forward to that report as a welcome foundation for working on that. And also looking at the ongoing role of service users and carer reps at this meeting as well, and the expectations. Thank you. Thank you so much. Thank you for today. I really appreciated it. Goodbye.
Thanks all.